Did you know that THC from cannabis doesn't just affect your mood or help relieve pain? Nowadays, scientists are continuously studying the potential of THC on cancer cells. THC, or tetrahydrocannabinol, is a key compound in cannabis that acts through the body's endocannabinoid system. Specifically, it interacts with cannabinoid receptors known as CB1 and CB2. Research has found that certain types of cancer cells may express these receptors differently from normal cells. This has led scientists to become interested in how THC might interfere with the growth processes of cancer cells. There are four main mechanisms currently being studied. The first is that THC may stimulate cancer cells to undergo a programmed cell death process called apoptosis. It's like sending a signal to abnormal cells to stop functioning and destroy themselves without causing severe inflammation in the surrounding tissue, unlike some other forms of cell death. Secondly, THC may stimulate the process of autophagy, which is a process where the cell breaks down and recycles its internal components. However, if this process is overly activated in cancer cells, it may cause the cells to be unable to survive. Thirdly, THC helps reduce the ability of cancer cells to invade and spread, a process known as metastasis. Since cancer spreading makes the disease more severe, researchers are studying whether THC can disrupt the pathways that allow cancer cells to move. And fourthly, THC may inhibit the formation of new blood vessels that supply oxygen and nutrients to the tumor. Angiogenesis. When a tumor can't create new blood vessels, its growth may slow down. However, it's important to understand that most of this information comes from studies at the cellular level and in animal models. It cannot yet be concluded that THC can cure cancer in humans, and cannabis or THC should not be used as a substitute for the main treatments recommended by doctors. Additionally, each type of cancer cell has a different number of cannabinoid receptors, and THC may have varying effects depending on the type of cancer, the dosage, and the individual characteristics of each patient. Therefore, the use of medical cannabis must be under the supervision of a physician. Medical cannabis may play a role in alleviating certain symptoms in cancer patients, such as pain, nausea, or insomnia. However, its role in directly destroying cancer cells still requires further clinical studies in humans. Research is a beacon of hope, but hope must go hand in hand with knowledge, safety, and scientific evidence. Medical knowledge by Dr.Gamhom EXR, as well as the well-known hydrogabinol SPO, Dental Cannabiomedics, Agency for Cancer, the B.